I could talk mixed methods research and why it's brilliant all day, but particularly why it's brilliant for child and adolescent mental health. Mental health, especially in that group, it's so complex, it's so complicated. This is such a nuanced, not just experience, but the kind of patterns that we see. And there's just so many things happening. And no single method, whether it's quantitative or qualitative, there is no approach that is going to tell us everything that we need to know. We have to be willing and able to be pragmatic and to explore that evidence or explore those phenomena in a way that reflects the complexity of it. So we need to bring to the table lots of different tools because there are lots of different things we need to learn and understand. So there's that kind of idea of reflecting that complexity and each method bringing a piece of a puzzle. So it being what we call complementarity within mixed methods, where the idea is that each question that we're asking using a different tool can tell us something different and put together those things create something bigger. They create a bigger set of knowledge than we might have had otherwise. I've seen that where we learn more from putting them together. So in my PhD thesis that was mixed methods using very, very different methods from kind of opposite ends of the spectrum, I used an approach called IPA, which is very interpretive. It's exploring lived experience among a small group of people. But I also had structural equation modelling, looking at 8,000 people, looking at patterns among those. And one of the things that I took away from that was that some of the language that we were using wasn't quite doing justice to some of the complexity. So we talk about risk and risk factors and who is at risk, but that kind of labels a group. And I know that's been talked about in other things, but it was definitely something that felt very, very strong in the work that I was doing in my PhD of this is not capturing the messiness of that. And it works when we're doing statistical language to say someone is at risk, someone is more vulnerable, but it doesn't feel like that in life. It feels like there is a pressure on you, you are stressed. And so things become more difficult. You're not at risk. You're facing a complex net of demands and we're potentially overlooking that when we call it risk. And I think, capturing that individual level experience versus the group. One method overlooks the individual because it's focused on patterns and then the other method is overlooking what's happening in the many. And we need both of those pictures. We need to understand both what's happening for individuals and also patterns across groups.